Hi guys, my name is Katie. I'm 25. I'm originally from Texas, but I now live in Portland, Oregon. I've been hearing a lot of kind of scary stuff about senior citizens and Medicare and the healthcare reform, and I know a lot of people are kind of worried about what healthcare reform will mean for Medicare. And I just kind of want to debunk three rumors. The first is that Medicare isn't government insurance. While some Medicare these days is operated by private insurance companies, all Medicare is still government run. It's all government insurance. So if you're on Medicare, you've got government insurance. Welcome to socialism. The second rumor is that healthcare reform will change your Medicare coverage, that you will no longer be guaranteed treatment regardless of age, regardless of pre-existing condition. This isn't true either. If there's a public option extended to everybody else, if healthcare is reformed, you will still receive your Medicare exactly as it is now. No changes. The thing it will mean, though, is that people like me who have a pre-existing condition will be able to get insurance that provides them treatment, regardless of that pre-existing condition. So for right now, for instance, no insurance company will take me on an individual plan because I have a pre-existing condition. If I want insurance, I have to get it through my employer. This limits where I can work. This definitely keeps me from ever starting my own business. I'm a web designer, and so freelancing, running my own business is a huge dream for me, but right now I will never be able to achieve that because I will not be able to have health insurance. Unless, of course, I get married, but I can't guarantee that I will get married to someone who has good health insurance either. So for me, the public option is a big deal because I, like you, would like to be guaranteed treatment regardless of my pre-existing condition. The third big rumor has to do with the end-of-life planning. I read an article, I think by Pat Buchanan, that's something like, "It's time to go, Grandpa." That's not what end-of-life planning is. End-of-life planning is about communicating to your doctor your wishes for, in the event that you become too sick, too ill to communicate for yourself how you want to be treated, you would be able to tell the doctor in advance, this is what I want, this is what I don't want. This doesn't mean your doctor can convince you, you're too old, we're not going to resuscitate you. It doesn't matter if you're 105, if you tell your doctor, I want to be resuscitated, I want to be kept alive, I want to keep having liquids and foods, and I want to be treated like somebody who's only 25, your doctor has to obey your wishes. And I think this is really helpful because it gives your family a good idea of what you want. It gives your doctor a good idea of what you want. There's no dispute. So end-of-life planning is a good thing, and it doesn't mean that your doctor gets to tell you it's time for you to go. Absolutely not. It's your choice how you go, and as a person who wants to see my grandmother live a very, very long time, I would never support any kind of healthcare reform that would tell people it's time to go. However, under private insurance, it is worth knowing that private insurance can often often does tell people that they're not going to pay for their life-saving treatment. People with cancer are turned away because the treatment is too expensive, too experimental. It's too much for the insurance company to bother covering, and I think that's very sad because people do lose their lives because their insurance company won't cover things. And if they don't lose their lives, they run the risk of losing their home, losing their good credit. Right now, medical expenses are one of the biggest reasons for bankruptcy and foreclosure, and we all know how much that's contributed to the current economic state we're in. And it's kind of scary to think that, you could at some point get very sick, your insurance company would deny your claims, and you would get stuck with a massive amount of debt. And it's for this reason that I support healthcare reform and a public option. It's not because I want to see your Medicare change. It's not because I want to see doctors telling you it's time for you to go. It's because I want to see everybody have the options that you seniors on Medicare have, which is to be treated regardless of your age, regardless of your preconditions, to be treated on the basis of your medical needs, not on the basis of whether or not it makes an insurance company a profit. Thank you so much for your time. I hope this has been helpful, and if you have any questions, please feel free to leave a comment or to respond with your own video message. I'm here all the time. Bye.